The good things. We are streaming live over at SuperTalk.fm. We're also streaming from the SuperTalk Mississippi app. Of course, we hope you know you can find us on your local SuperTalk Mississippi radio station. And if you're looking for maybe some lifestyle coaching and you've got Medicare, then this is the conversation for you. Joining us is Phil Trotter. He's with the Diabetes Prevention Program. And Mississippi is offering free diabetes prevention lifestyle coaching for Medicare beneficiaries. Hey, this is cool moving into the new year. So, Phil, you got some good news for us, huh?
Absolutely. It's the new year, new you for Medicare Part B recipients. And so Mississippi has a lifestyle care. It's called Mississippi Lifestyle Care, where through your Medicare Part B as a recipient and as a benefit, free lifestyle coaching for a year. So that's to help you feel good, look better, and live longer.
Which I think we can all sort of get behind. And this is one of those benefits. I know as open enrollment and everything starts changing and everyone's talking about it, can get real confusing. And when you hear the words free, you kind of wonder what that means. What do I actually get? Who is this actually for? So explain all of that for us.
Exactly right. So this is specifically for those that have original Medicare, so Medicare Part B. And as part of that Medicare Part B benefit, you can have a year-long lifestyle coach to work with you. And it's mainly behind what's called the Medicare Diabetes Prevention Program. And so, as we know, the best way to prevent diabetes is to really have a good lifestyle. So you can have a coach available to you in person, in your community, provide you with nutritional help, exercise, stress reduction, sleep, all the things that you would typically say, oh, I need to go down the street and get a healthcare membership, or I need to hire a personal trainer. You don't have to do that. As part of your Medicare Part B benefits, you can get this lifestyle coach, and there's at no additional cost to the beneficiary.
So Mississippi's kind of leading the way in this, right, Phil? As I understand it, we're one of the few states that are really embracing it. We may not be the only state that has it, but I feel like we are doing well by letting folks know that they can take advantage of this, because this isn't just about weight loss or even whatever. This is about preventing chronic disease that then prevents early deaths and other unfortunate outcomes with uncontrolled diabetes.
That's exactly right, and it's specifically, though, for the prevention. So if you've already been diagnosed with diabetes, then this isn't really a benefit you can take advantage of. But if you have you qualify as prediabetes, so in other words, you have an A1C that's anywhere between 5.7 and 6.4, and the lifestyle coach will help you figure that out. If you're there, then that's when you get this free benefit. So it's really strictly for the prevention. We do have other programs if you've been diagnosed with diabetes, but specifically this program is for the prevention.
Let's talk about numbers here in Mississippi. How many could potentially utilize this program or need to utilize this program?
We have 165,000 Medicare Part B recipients that are prediabetes. And, of course, many of them don't even know they have it. But all you have to do to find out if you're eligible is go to mslifestylecare.com. So mslifestylecare.com. And first of all, you will determine your eligibility as a Medicare Part B recipient on that website, and then a lifestyle coach will contact you and help you find out if you're eligible for the program. And again, there's no cost to this at any time along the way, either for finding out if you're eligible, if you qualify or not. And so if you do qualify, then that lifestyle coach will enroll you in the program and get you started.
Have there already been, and I think I know the answer, but I think there's already been some groups or some cohorts of taking advantage of the lifestyle coaching in some of our communities throughout Mississippi. What is it showing us? Is it helping folks? Are folks able to maybe, reverse their prediabetes, or maybe see that they, break the cycle within their family of falling into the line of developing it later in life?
It absolutely has. In fact, we've had probably over 1,000 now that have participated in the program. So the program's actually been around for Medicare DPP since 2018. But now we have an initiative where we're recruiting lifestyle coaches and then having them placed in every zip code throughout the state. So we have lifestyle coaches in every state. These are fully trained in the diabetes prevention process, and we also help those as part of the program. We also help those that have other needs. So if there's some food insecurity or some housing issues, we also have access to resources for that. But this is primarily about lifestyle change, and we've seen that the majority of those who participate and stick with the program, it actually slows, stops, or even reverses the progression to the onset of type 2 diabetes.
Which I think anyone listening who has watched a loved one manage it or is managing it wouldn't want it for anyone else in their family. But let's talk commitment. You mentioned a year. That feels scary. I mean, most of us, we know we'll be setting those New Year's resolutions, and then poop will hit the fan before, January 15th. And so I know there's no cost or whatever, but what are we talking about in terms of the commitment? Is it once a month you meet, once a week? How does that kind of work for folks?
Yeah, so it starts out, it's a great question, and it starts off as a once-a-week program for the first 4 months, and then it's once a month till the end of the year. And so the commitment, most of the commitment is done in the first 4 months, but it's only one session, one-hour session per week.
So Medicare, that would mean that you are wise in years, right, Phil? You would have to be a certain mature level to have Medicare. What about all the rest that maybe, we hope, we're waiting on that Medicare age, but we're not there yet. What would you say to those that are maybe looking to take charge of their health this upcoming year as well, at least in the realm of prevention of diabetes?
Yes, and and it all gets down to diet and exercise, and so it's all about the foods that you eat. It's all about the exercise time that you take. That's recommended. The national standards are 150 minutes of physical activity per week, and then of course a diet that hopefully doesn't contain a lot of sugar. But I want to say that the Mississippi Lifestyle Care will eventually include, many other healthcare payers that will provide reimbursement for this program. So what we're hoping to do is to get healthcare in general, beyond Medicare, healthcare in general to reimburse for the delivery of this program. Because again, it's all about, yes, not getting that chronic, the diabetes type 2 chronic disease. But the thing about diabetes, and the reason it's such a devastating disease, is that it generally comes along with other chronic diseases. And so generally you'll get heart disease, and there'll be other things that come along with being diagnosed with diabetes. So it's really, really important to maintain a good lifestyle. And we're helping Mississippians do that through this program.
And two, you're more likely to stick with it if you have a community. And from what I can tell about the program, Phil, is that it's community-based. You have your lifestyle coach, but I think there may also be an opportunity to have some group interaction if you want, or, be able to share with others. And so that's always helpful in being supported and motivated. And so... Yep. And two, if you are of the Medicare Part B and you meet the requirements, you can come home and teach your other ones what you're sort of learning, and hopefully
exactly
they won't necessarily need it whenever they get to that much wiser age.
That's exactly right.
There, Phil.
That's exactly right.
I think this is great. I think everyone who could qualify should take advantage of it. You might as well. That's how we get more programs like this and the support that's needed. So where do we go to learn more?
MSLifestylecare.com.
All righty.
Yep.
All
and
right.
we look forward to seeing you.
All righty.
Come join us.
Well, Phil, you keep us updated with how it's going, and look forward to hearing about it as well.
Thank you so much, Rebecca.
All righty. If you're feeling stuffed like a turkey, then maybe you should take advantage. I think this is really cool. It's statewide. It's free. It connects you with resources that maybe you otherwise wouldn't have the opportunity to connect with. And why not look into it? If you are a Medicare Part B, all that mumbo jumbo can be confusing. But if you don't know, I guess call and ask. Not me, your Medicare person. And they'll let you know. All right, stick with us. We got more for you up next.